Chylomicronemia syndrome. It is an irritating disorder in which the body does not break down fats. It causes fat particles called chylomicrons to build up in the blood. Cause chylomicronemia syndrome can occur due to a rare genetic disorder in which a protein called lipoprotein is missing or altered.
This is Dr. Cal Shipley with a review of endocarditis, cardiac valve agitations, and stroke. Endocarditis can occur when there is fungal or, more commonly, bacterial infection in the bloodstream, a condition known as septicemia or sepsis. As the organisms travel through the heart, they attach themselves to the valve leaflets between the heart chambers.
So during the past decade, I have seen two young women who have familial chylomicronemia syndrome, and the disease basically presented while they were college students.
Unpredictably, vegetations may detach from the
They had a pretty normal childhood and a pretty normal adolescence. But while at college, both of these young women were put on birth control pills by their college infirmaries. Birth control pills or estrogens of any type tend to raise triglycerides, and both these young women ended up with pancreatitis, occurring in college as the first presentation for this disease.
Symptoms might start in infancy and include abdominal pain due to pancreatitis, symptoms of nerve damage, and loss of sensation.
Infective endocarditis is an inflammation of the heart. It can damage the valves of the heart muscle, or the lining of the heart. It's caused by bacteria.
Well, someone can have high triglycerides and have no other symptoms. In fact, that's why many people do fine for a while.
Minor bleeding
But
that might allow these
the
bacteria into your
symptoms
bloodstream.
are most commonly related to the pancreatitis. So severe mid-epigastric abdominal pain radiating to the back, and they can often present in childhood. So certainly children have this condition and often are not diagnosed with it. Skin findings can occur, so a particular type of skin called xanthomas, eruptive xanthomas that come out of the skin. And of course, the most distinguishing feature is, in fact, high triglycerides, which, when they're high enough, can actually make the blood look a bit creamy in color. And that's sometimes the first time this is identified is when a child or an adult with this condition has blood drawn, and their blood is a bit curly or creamy in color as a tip-off that they have this condition. Before an individual with FCS has pancreatitis, this is basically a silent condition. People have high triglycerides but don't know they have high triglycerides, and in fact will not know unless they actually get them measured as part of the screening test. So this is often an underdiagnosed disorder, especially prior to the first episode of pancreatitis, because it's silent. It's not causing any symptoms, and someone would have to have a blood test, and specifically the triglyceride measures in order to pick it up. So that's really the big tip-off is that high triglyceride screening. Of course, unfortunately, many people don't get diagnosed until they have their first episode of pancreatitis, which should definitely tip off the possibility of this condition. But of course, that first episode of pancreatitis can be very severe, and in some cases, regrettably, can be fatal.
We underline the fact that both transthoracic and transesophageal echocardiogram are needed in the clinical practice. What is important is to perform echocardiogram very early in the course of the disease. The last point is probably the most important, that is the indication for surgery. The three main indications for surgery are heart failure, abscess or neurovalvular complications, and finally embolic complications. And the trend of this recommendation is to recommend early surgery, but sometimes urgent surgery, that is, during the first week after initiation of antibiotic therapy in the majority of the patients who have the indication for surgery.
There is no way to prevent the syndrome, but sticking to a fat-free diet and avoiding skin and the articular symptoms. Generally continues therapy for 4-6 weeks to completely eliminate the bacteria from the hair chamber and hair bags. Antibiotic treatment those are in the hospital, so continuous